colleagues, a warm welcome to South Africa and Cape Town in particular. I'm hoping that people are not going to be bored and sort of look seawards. There's going to be plenty of time to do that. I know that's been built into the program. The issue of health and human rights has a particular resonance in a country where the majority of people, up until 1994, were denied realization, never mind full realization, of rights or access to quality health care. 13 years into democracy, many, many challenges remain. And I'm going to quote from a wonderful book that the ALP has put together, and I hadn't realized that there were going to be some for sale. So if you can, grab a copy. It's wonderful. And some of the challenges that South Africa continues to face include continuing inequalities and imbalances between the public and private health sectors, the shortage of doctors, nurses, pharmacists in many poorer parts of the country, the HIV/AIDS epidemic, and no doubt you've heard and read lots and lots about that, international trade laws that limit access to affordable medicines, the failure of the Ministry of Health to fulfill its legal duties and ensure that the laws and policies it adopts passes constitutional tests. No doubt over the next couple of days, we're going to be interrogating many, many of these issues as we construct a way forward, how these two important issues of health and human rights must converge of necessity. The foreword of this book has a wonderful piece by the Deputy Minister of Health, Nasiswe Madladla-Rutledge, and we tried very hard to get her to come to this meeting, but she had a series of obligations that prevented her from doing so. And in her foreword, she says, the Bill of Rights in South Africa, in the Constitution, which is Chapter 2, deliberately connects people's rights to participate in political governance to their rights to conditions of life that will allow them to live with dignity as equals. She goes on, and I found this particularly poignant, where she says, one of the greatest health and social challenges our country faces is the HIV/AIDS epidemic. Former President Nelson Mandela said, AIDS is no longer just a health issue. It is a human rights issue. It is a human rights issue if people who need and qualify for treatment cannot get it because they have to be put on a long waiting list, or they cannot afford transport cost to the HIV/AIDS clinic. It is a human rights issue that babies continue to be infected by their HIV-positive mothers because the clinic sister has neglected to tell the pregnant mother about how she could reduce the risk of her baby being infected. It is a human rights issue when babies cannot access treatment and when people die because they are poor. It is a human rights issue that HIV/AIDS has the face of a woman, that women and children become infected as a result of rape or other forms of gender-based violence. I think one could transpose the issue and the example of HIV/AIDS here on any number of issues that we're going to be discussing over the next couple of days, whether it's palliative care and human rights, whether it's sexual health and human rights. One could use the same example of access to quality health care as a fundamental human right. Thank you very much, and a warm welcome again.